Today we're going to look at electronic health records, and we're going to talk about how they were first began, how they'll be implemented, and then how that we will use them going forward to satisfy the needs of health providers. The first part that we'll look at is how they will apply these healthcare records in the area of practice management. And practice management software really is a way for healthcare providers to gather data, to track that information, and then ways to store it for every patient from the time that they make an appointment through the time that the bill is paid by the payer or by the patient. So these kinds of applications will include scheduling appointments, demographic information, which is name, age, social security number, insurance information will be included in this practice management applications. And in here we will also be assigning ICD-9 and CPT codes. Those will be the codes that are used in order to track a patient's health care and in order to be paid by the insurance company. Another type of practice management application is going to be billing claims forms. An electronic health or medical record software is going to include clinical documentation as well as practice management documentation for patient care. And this will include a patient's medical history, and we'll talk about some of those histories as we go through this lecture. It's going to include patient visit and the information that we get on a progress note, or the documentation that we put down for what a patient has said is going on with them, and then things that we observe and the things that we measure while we're taking care of a patient. It will include e-prescribing. This is an electronic way to prescribe and to get medications ordered for a patient from a pharmacy. Also included in these clinical documentations will be diagnostic tests that are ordered and the results that we get back from them. When you're looking at electronic health records and why these things are being done, every office is going to have to implement these electronic health records by the end of 2014. And when you look at some of the advantages of having an electronic health record, it would be to have possibly more secure records than with paper records. And the reason we say possibly is because everything that is done in an office could be done incorrectly, and we want to make sure that whether it's electronic or paper, that we're doing everything possible to make sure that these records are secure. All the information is going to be in one place with an electronic health record. It'll all be under a patient's file, and it will be everything clinical, administrative, and also the ability to get information from other providers all in one place. That's the interoperability that we're talking about here, and that is that everyone has access to a patient's information even if they're not in the same office, and this is going to help us to assure that we are compliant with the regulatory commissions that are out there, and that the exchange of information with everyone who needs that information will be readily available. Some of the disadvantages of an electronic health record is that there is some increased security functions that have to be put into place. There are things that have to be implemented in the office to make sure that this information is now secure because it is accessible by so many people. It is very costly in most cases to implement an electronic health record system in an office or in a hospital. And this high cost is taken on by the practice in many cases, but we'll talk about some of the reimbursements that can be had by the government agencies that want us to implement these electronic health records. And also there is pretty extensive training of all staff members who will be using these electronic health records. So when we're looking at getting these electronic health records implemented into an office, we need to be sure that we know, or whoever's in charge knows, who's going to be using this information. Who do you have in your practice that's going to use this software, and how are they going to be using the software? And this will be important when the decisions are being made about which software we're going to purchase and implement. There is a chief information officer, and this person's going to be responsible for choosing the product that the practice will use. So their job is going to be to gather information about the different software packages that are out there and decide which one's going to be best for that practice. The administrators or managers are the ones that are going to be responsible for implementing this software, and they're the ones that are going to plan and administer the training of the folks that will be using it. Then you have your care providers. They will be the ones that will be documenting in the software, and so their input's going to be important because ease of use is going to be a real important part of choosing a software because care providers obviously want to spend time taking care of a patient and not fumbling through electronic health software. Nurses or medical assistants are going to be the individuals who will be entering a lot of this documentation, and they will probably be the ones who will be retrieving the data that's out there in the software, and they will be the ones helping the patients get better care with an EHR. So the information that's going to go into an EHR is going to be several pieces of data, if you will. And data is defined really as a single fact. Information like female, the age of that patient, and any allergies that they have. Any single fact is considered data. When you take those facts and you put them together to document, that's going to be considered information. An example here is that Janice Jones is allergic to penicillin and she breaks into hives, has difficulty breathing, and required an emergency room visit for her last penicillin reaction. And the data is put in as information keyed in, but then we want to put that information together, or those facts together, to come up with information. There's certain equipment that we're going to use as we gather this healthcare information, and this will include computers, laptops, notebooks, iPads, iPhones, and PDAs. And the information will be put into this equipment depending on what they decide to use at the level where they're going to implement their EHR. Data has to be collected, and that can be collected verbally from the patient or the patient's representative. In case of a pediatric office, that would be a parent. And in the case of an elder parent who really is having difficult time verbalizing what's going on, it may be whoever they bring in as their representative. Data could be collected by a patient completing a form, and in most cases a medical practice is going to collect this data by a combination of both verbal and written forms. In 2003, the Institute of Medicine defined that there were certain functions that needed to be in every electronic health record, and that is health information and the data that's collected about a person's health. There needs to be result management. In other words, how are we going to deal with the information that we have and the results that we find? Order management, and that could be ordering tests, it could be ordering other types of medications that are ordered. Decision support is an important part of a function, and the decisions that are made by care providers will be dependent upon the information that's in an EHR. Electronic communication and connectivity, and that could include email, that could include the scanning of different tests and results. Patient support, what are we going to do with this information that we have, and how are we better supporting our patients because now we have all this information collected in one place. Administrative processes and reporting, and that would be the reports that we get from an EHR, and how are we going to use those reports, and again, reporting and on health and population that you see in your office as well as in communities will be gathered and would be accessible from an EHR. The Health Information Portability and Accountability Act, HIPAA, is something we've all heard of whether we've worked in healthcare or not. And a lot of people, when they hear HIPAA, think that it is just about the security of healthcare information. But in 1996, when this was passed, it has many, many purposes. One of them is to make sure that people who leave their employment have the ability to keep their healthcare information and their health insurance, even if they've already had a pre-existing medical condition. In other words, if you leave your place of employment they make sure that as you move to your next place of employment, you have the ability to keep your health insurance or to obtain new health insurance, even if you've already been diagnosed with diabetes or cancer. And really this was put in place so that people aren't left with an illness with no insurance to cover them. HIPAA also sets standards for storing, maintaining, and sharing electronic health information. It is going to set up rules that ensure that the privacy of this health information and the use of protected health information is overseen, and that there are rules set in place so that folks who have all their healthcare information out in an electronic format know that it is protected and it's not accessible to everyone. There are rules for standardization so that we are all sort of collecting and exchanging this information in a standardized way so that everyone who uses this information is under the same set of rules and policies. The Health Information Technology for Economic and Clinical Health Act, also called HITECH, was put in place so that we could increase the use of electronic health records in hospitals and physician practices by putting in place an incentive program. And the physicians and hospitals that are able to show meaningful use of this information that they've collected will be able to benefit monetarily from implementing an EHR. There are 3 stages for meaningful use. The first is collection and use of the information and data. Second is that they are able to show that there's a secure exchange of this information. And thirdly, they're able to show that they use the patient data to improve patient outcomes. And if you visit the hhs.gov website, it gives lots of details about this Health Information Technology, Economic, and Clinical Health Act. They put in place a team of folks called the Office of National Coordinator. And this Office of the National Coordinator was put in place so that they would be able to coordinate nationwide efforts to implement and use health information technology and the electronic exchange of information. In other words, they're going to oversee how this information is put into place and that we are doing our due diligence in the exchange of information and keeping it secure. When you're looking at a physician office and a hospital, some of the information that's collected is different and some of it that is collected is the same. And really an electronic health record is set into place so that we can capture timely, accurate, usable health information that's going to ensure quality medical care for a patient, that's going to provide for coordination of that care between multiple providers, that we will be able to support the medical necessity for diagnostic testing. The information that goes into an EHR is going to track diagnoses and going to track the testing that happens because of these diagnoses. It's going to protect the legal interests of the patient, the provider, and the hospital. We will collect data that is going to be used in statistical reporting in the community, a local community, a state community, and even national communities. That information that's collected will be able to help us keep statistics and be able to report on the national healthcare issues that are going on. And we will also be able to file insurance claims through this electronic health record. The non-clinical data that's collected is going to be considered administrative data. This doesn't include anything to do with diagnosis, prognosis, the treatment, or the plan of care. It's going to include information such as the full name, date of birth, gender, social security number, the marital status, address, and phone number. It could also include employer or student information, who the next of kin is, the race, ethnicity, and insurance policy name, policy number, and group number. Those would all be considered administrative data. HIPAA data requirements on administrative data is information that's going to be used in health claims for reimbursement. If it's a hospital health claim, it's going to be the UB04 form, and if it is in a physician practice, it's going to be the CMS 1500. Information that needs to be on this are provider information. Who is the physician? What is their address? What is their ID number and their telephone number? Also included in health claims forms are going to be the subscriber and the patient information. Who's the policyholder and what is the insurance name? What is the insurance ID number, the patient ID number, and what is the patient's relationship to the policyholder? Sometimes it may not be the patient that is the policyholder, but they are part of a policyholder's subscriber. Payer information is going to be included in here, and that is the insurance plan name, the plan ID, the assignment of benefits, and the release of information. We will not be able to share any of the patient's information with an insurance company unless we have a release of information authorization from the patient. These are forms that are filled out when a patient first comes into a practice. We will have in there referral and any prior authorization information. Some insurance companies require that we get prior authorization before some tests are obtained. And so we need to make sure that's all in place in order for a patient's payer to reimburse us. There will be claim details on there. Once a patient is seen, we're going to submit charges based on what the procedures were and what the diagnoses were. We're going to include the date of service and any codes that need to be in there, and those would be the ICD-9 or diagnostic codes and the CPT or procedural codes. We will need to provide proof of meaningful use as we move into using our electronic health records. And this is required in order to be considered compliant. Providers who are planning on taking advantage of the monetary incentives that are offered by HITECH must use an EHR in a way that improves patient care. And that's what meaningful use is all about. It's not just enough to use the system. We need to be able to report that we've shared information and that the patients are benefiting from this shared information. There must be administrative data that includes reporting race, ethnicity, preferred language, gender, and date of birth. Those are considered optional in an administrative reporting, but if you're going to prove meaningful use, these have to be included in the administrative data. One example of clinical data must include smoking status. This would be able to produce a report that showed maybe some smoking asthma relationships. It may be that the patients in a specific zip code with COPD could be reported. In other words, meaningful use data is going to be able to help us produce reports that are going to show better patient care, not just for this patient, but for patients in our community. All hospitals will have a master patient index, and this is a way of tracking a patient who is seen in this healthcare facility. There is only one entry per patient, and then each encounter is recorded separately. Each patient will have one medical record number that's unique to them, and it can be done manually or electronically, and it is kept permanently so that one patient has one number and everything that happens in that patient, in that healthcare facility, is tracked by that medical record number. In a physician's office, this process starts with patient registration, and that's usually completed by the reception staff. In a hospital setting, it's usually a centralized registration department that would do this. And again, it will include the patient's name, address, date of birth, the contact information, marital status, race, ethnicity, what is their primary language, their insurance information, and their emergency contact information. The provider has to be assigned prior to scheduling the appointment. A patient will call and want to schedule an appointment, and we need to make sure that we are going to assign who that provider is. We have to also, when we're scheduling an appointment, make sure that the reason for the visit is put in place so that we can make sure to allot sufficient time in the appointment scheduling. The date and the time selected for that patient will be based on what works best for them. All the information must be current and correct, and we must verify that information when that patient arrives at check-in. So once the patient makes the appointment, they now arrive for their visit, and we want to make sure that the information that we gathered when we made the appointment can be verified. That may be that they produce an insurance card. It may be that we make sure that we've gotten all the information correct. And then we want to make sure at that point that we edit, add, or delete any information that is obtained when the patient arrives. The flow of patient care through an office usually has a very typical flow. It starts when the patient checks in at the reception desk, and again, we want to make sure that we verify that the information that we have is current and that it's correct. Then the patient is called into the exam room by the health professional, and they start by including any of the history that a patient may give us, and then the chief complaint is going to be obtained as we start to document information that will be used for this patient's visit. The patient is then seen and examined by the provider, and the provider will decide whether there needs to be some diagnostic tests ordered and or any other treatment that's going to be provided after the patient leaves the practice. The patient's going to check out, and they're going to get any lab requisitions that they need. We're going to make sure that if we're ordering some tests that need prior approvals, that those are obtained, and that we are going to give this information to the patient and explain what needs to happen next. At that point, we are going to process the claim and all the insurance information that's essential and to send in for reimbursement. We need to make sure that it is complete and correct.